games.
Wouldn't be surprised. And there's a couple things that came to my mind, Pat. When I heard this news, Casey Warner texting us yesterday when this news broke after we got off the air, a couple things started racing, right? First of all, you start thinking about what this team's going to look like without Tristan Wirfs for, let's say, 4 weeks. The optimism coming into this season, what we've been talking about, not only with this team, with this offense, but specifically with this offensive line and the growth we've seen from this offensive line, taking this, being a large part of why this rushing offense went from one of the worst to one of the best in football. Yep. So you immediately start thinking about that. And then you start thinking about, like you mentioned, last year. And you start thinking about missing a game. And then you start to remember, okay, a couple weeks ago, he had a brace on his knee. And nobody was really paying attention to it because that's normal. Guys having, especially offensive linemen, big guys on the line, having braces on their knees, having things on their legs, and that's just part of it.
Well, it was noticed enough that Todd Bowles was asked about it, and here's the quote from Todd Bowles at the time. It's precautionary. It's the offseason. He'll be fine in training camp.
And why do you think nobody asked questions after that? Because that's a normal response to normal, like I said. You see knee braces on guys all the time. Of course, if you ask about it, and that's normal to ask about it, it should be asked about. And then you get that response from Todd Bowles where he seems calm and no panic from him. So then you kind of let it go. And nobody was talking about it after that. That was it. Why? If we knew he had these issues, if they knew that this was an issue, why now are you just figuring out, and they went in and did a scope or whatever they do? We'll talk to Ian Beckles about it. He knows more about the scopes, I'm sure, than
Well, they went in and did a surgery. There was a surgery done, and then they found more damage than they knew was there, and then repaired that as well while they were in there.
Why was that? We'd have to talk to a doctor, I guess, at Florida Orthopedic Institute, but why was that?
Why do we just think of that now?
Right. Even that minor procedure that turned into finding more.
Yeah.
Why was that done so recently? Why wasn't that done earlier in the summer?
It's a good question, and it's one I certainly don't have an answer for. My assumption is, the only assumption I can make is that, because obviously they've looked at it, right? They've looked at his knee since the injury, since he played last season. Like, there's no doubt it's been looked at. My assumption is that they thought it was something that could heal without surgery, and that we would be at a point, as Todd Bowles said, that he'd be fine during training camp. Obviously, they realized that wasn't going to be the case, and they thought it was probably something minor they could go in and clean up, and maybe he doesn't F around much during the preseason, we don't really see him in the preseason, but he'll be good for week 1. That was, I assume, had to be the expectation. Otherwise, why wouldn't you assume?
And I get that assumption, but even with that, why wouldn't you do that minor procedure? Like, why would you wait to get that clean, whatever you needed to clean out? Why would you wait to do that to now?
Well, again, my assumption, and we would have to talk to a doctor or somebody with the Buccaneers.
Even if they thought it was
Jason,
minor, though.
Jason Light, if you're listening and you want to text us. No. Again, my assumption is they thought it would clear up without surgery, that they didn't need to go in.
Okay. And then they realized, okay, now we do have to go in. Then they found something more.
If you have to do, I'm totally with you. If you know you have to do the surgery, why are we waiting until right before training camp to do the surgery?
Yes.
My assumption is
that makes sense.
They figured this is something based on what they've obviously looked at it and have been since the injury happened. Talk about the investment in somebody, the money they're paying this guy. They're paying attention.
And Tristan's working out, so the aggravation he's feeling from it, he probably thought, okay, it's going to get better. And he's like, guys, and he's being honest about it, which is great. It's not getting better. And that's what we want. We want athletes, when they're getting paid as much as Tristan Wirfs, when they're as big a part of the team as Tristan Wirfs, I want them being very open and honest about what their body is telling them.